Yes.
All right, we'll go ahead and call the meeting to order. This is the Senate Standing Committee on Health and Welfare. This is meeting number 9. The date is March the 5th, 2021. Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Present in the room.
Senator Givens. Senator Harper Angel. Senator Howell.
Here.
Senator Kerr. Senator Meredith.
Present in the room.
Senator Nemes.
Present in the room.
Senator Wise.
Present in the room.
Chairman Alvarado.
Present in the room, and let the record show that Senator Adams has arrived as well during the roll call. Very good. We've got an aggressive agenda here. I know it's late on a Friday. People are wanting to get home, so I will let the presenters know that if you get a quick motion, please do not be insulted or take that in any negative way. A lot of our members have vetted these bills prior, and I think a lot of us feel comfortable with what's on the agenda today. Let's start with the very top. We'll start with House Bill 48, an act relating to reimbursement for pharmacist services. The sponsor is Representative Danny Bentley. Representative Bentley, if you'd like to come forward, introduce yourself and any guests that you might have, and please begin your testimony.
My name is Danny R. Bentley, District 98 Representative. I have Ben Mudd, the CEO of KPHA, on Zoom. I think that's the only guest I have. I'm going to give you the short version of this because most people have already heard it. But this was filed in September of 2020. When it went through the House, there's no subs, and we had over 50 co-sponsors. House Bill 48 is an important piece of legislation to ensure the citizens of the Commonwealth have access to pharmacist services that can improve health outcomes and lower health care costs. Pharmacists are highly trained healthcare providers, but unfortunately, in Kentucky, they are not compensated for many services they provide. And like other healthcare providers who get paid for delivering services, currently there is no mechanism for pharmacists to submit claims and receive reimbursement for providing the same care for which other providers are paid. This is due to decades of the long separation of pharmacy benefits, which pay for medications, from medical benefits, which pay for services such as healthcare provider visits, or a rapid flu test, or smoking cessation counseling, to name a few. Pharmacists are able, under the current scope of practice in Kentucky, to provide many of these services, yet are not able to bill for them. Under House Bill 48, insurers and health plans will not be able to deny reimbursement to a pharmacist for providing a service or procedure within the pharmacist's scope of practice. If that same service or procedure is covered by the plan, which, when provided by a physician, advanced practice nurse, or physician assistant. HB 48 is not an expansion of pharmacist scope of practice. It establishes a claim submission process that ensures pharmacists are reimbursed for the same service for which care providers are reimbursed. Health insurers could reimburse the pharmacist just as they reimburse other non-physician providers. The Kentucky Primary Care Association endorses this. The KPHA and 34 other states have this status. Thank you, Mr. Chairman.
Thank you. You have a motion on the bill. There's a second. Senator Carroll, you have a question.
Just quickly, and please don't take this question as any judgment whatsoever. When I read this, my first thought was that aren't these things that pharmacies do to attract business? When they provide these extra services, are they not intended as more of a marketing tool? And correct me if I'm wrong. That thought just came to mind.
As a niche to increase business, but let me give you an example. Steve Sheldon got 500 doses of J&J. It was gone in 2 hours. That's a pharmacist service. And I got pictures with me, if y'all want to see them, going to this lady's house who's handicapped. He sent 2 pharmacists. They never got paid for it. And when she's done, she got her thumbs up. We provide that service. She is now vaccinated against COVID-19.
Thank you,
That's a very good example.
Thank you, sir.
Thank you, Senator Carroll. I mean, and to that point, I think, again, medical providers get a reimbursement for administration of an injection. It's a small amount, but nonetheless, it's some, and it adds up after a while for a lot of practices. I know, Representative Bentley, I know when you'd said, hey, I'd like to have this bill heard. I said, hey, let's make sure the docs are okay with it because there is always a concern about scope of practice that we're going to lay this down, then there will be an expansion of that and a creep of that in the future. I've gotten reassurances from you, from members of the Board of Pharmacy, that that's not the intention of this bill at all. And so I feel much more comfortable. And since then, I've also gotten a lot of emails from physicians asking for this bill because they work hand in hand with a lot of pharmacists in their community.
Yes.
So I thank you for that. Any other comments or questions? Otherwise, you have a motion and a second on the bill. No other comments? Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe.
Aye.
Senator Kerr.
Aye.
Senator Meredith. Senator Nemes.
Aye.
Senator Wise.
Aye.
Chairman Alvarado.
Aye. The matter passes 9-0 unanimously. It's eligible for consent. Do we have a motion? We have a motion and a second. All those in favor, please signify by saying aye. Anyone opposed? Very good. The matter is on consent.
Thank you, Mr. Chairman.
Stay right there, Representative. You have one other bill here for us, I think, is House Bill 427.
Yes, sir.
It's an act relating to the Kentucky Opioid Abatement Advisory Commission, making an appropriation therefore and declaring an emergency. If you'd like to, again, introduce any guests that are here with you, and they can also begin their testimony.
I have Victor Maddox. He's Assistant Deputy Attorney General from the Attorney General's Office, and is Gary Moore on Zoom. He is the judge exec from Boone County. That's my two guests.
I am here.
Yes, sir. Thank you. Anyone else? I think that's all. How you doing? Good. I'll give you the short version of this one too. Ready?
Please proceed. I'm sorry.
House Bill 427 presents a collaborative agreement among counties, cities, and the Commonwealth to distribute the proceeds of a potential settlement against certain opioid manufacturers and distributors. Over 100 Kentucky counties and some Kentucky cities have brought litigation against these defendants, as has the Commonwealth. For some time now, the parties have been discussing a potential settlement of these cases. House Bill 427 provides for what will happen with settlement funds if a settlement is reached. Specifically, the Commonwealth will receive 50% of the funds, and local governments will receive 50% of the funds. Crucially, this compromise between the Commonwealth and its political subdivisions will, under the settlement being discussed, result in significantly more money to fight the opioid epidemic in Kentucky. This money is only for fighting the opioid epidemic. The bill provides accountability that will prevent fraud and waste, ensuring every dollar ends up where it's needed most. In sum, House Bill 427 will put us on the path to victory over the opioid epidemic. The path to victory. That's a victory against the opioid epidemic, which has plagued our state, and especially my area of the state. The results of legal actions against the manufacturers. So it is a victory against the opioid epidemic. It is a collaborative victory where we see the cities, counties, and Commonwealth all together to fight the opioid epidemic. And it is a victory with near-term benefits. If this bill is passed, and if emergency regulations on the applications for funds could be received, reviewed, and potentially approved this year. Thank you, Mr. Chairman. I'll ask the Attorney General's office if they want to speak.
I don't have any other remarks. Mr. Chairman, I certainly endorse Representative Bentley.
If you might want to turn your microphone on just briefly.
Yeah.
Thank you.
We certainly endorse Representative Bentley's remarks. I'm happy to answer any questions.
Thank you very much. We have a motion on the bill. Is there a second? A motion and a second. Any other questions?
I don't know if Judge Exec had a comment.
Very good. If you'd like to also, please, for our two guests, if you could introduce yourselves for the record officially so we can have you on the record as far as who you are in your office that you hold.
Introduce yourselves again.
Chairman Victor Maddox, I'm Assistant Deputy Attorney General.
And Judge?
My name is Gary Moore. I am the Boone County Judge Executive
It's good to see you,
and
Judge.
past president of CAECO. And I have no comments. I'm here to answer any questions you might have.
Thank you, Judge. Good to see you again. Appreciate that. Any other questions or comments? If not, we have a motion and a second. Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel, Senator Howe,
Aye.
Senator Kerr,
Aye.
Senator Meredith, Senator Nemes,
Yes, I'm sorry, Senator Nemes.
I'm going to cast an aye vote, and I wanted to thank Representative Bentley for bringing these two bills. Almost voted against the other one because you had my son as a co-sponsor, but it's a good bill, and you're well respected. And Mr. Maddox, I thoroughly enjoyed your presentation.
Thank you, Senator.
Senator Wise,
Aye.
Chairman Alvarado.
Aye. The matter passes unanimously with a 9-0 vote. It is eligible for consent. Do we have a motion? We have a motion. Is there a second? Second. All those in favor, please signify by saying aye. Anybody opposed? Very good. The matter is on consent. Thank you, gentlemen, for being here. We
Thank you,
appreciate
Mr. Chairman, and thank you, committee.
Thank you. Next, we'll take up House Bill 276, an act relating to temporary nurse aides and declaring an emergency. The sponsor is Chairwoman Kim Mosier. And Chairwoman, if you'd like to introduce yourself for the record, you're no stranger to our committee, obviously, but if you have any guests, also they can themselves testimony when you're ready.
I do. Thank you so much, Mr. Chair, and thank you, committee, for hearing this bill on a late afternoon when we're all ready to get out of here. I am Kim Mosier, State Rep for the 64th District, for the record, and with me I have Betsy Johnson with the Long-Term Care Association. I know I got that wrong. Sorry, Betsy, but this is a great bill. It's a very simple provision. House Bill 276 allows any nurses' aides who were trained as temporary COVID workers during and personal care attendants during COVID to use the hours, the supervised training hours that they obtained in working, and apply those toward their state registered nurse aide certification and registration. This helped fill shortages during COVID. It'll help fill nursing shortages and nurses' aide shortages moving forward in long-term care facilities. We know that this is an ongoing problem. Not to mention the fact that we have a nursing shortage altogether. And so this creates a nice pipeline for individuals who hope to get into the nursing field, and starting with their nurses' aide training, hopefully move into a career path. So
We have a motion and a second on the bill. I think, Chairwoman, you said enough. Any questions or concerns or comments? If not, Madam Secretary, please call the roll.
Senator Carroll,
Aye.
Senator Harper Angel, Senator Howe,
Aye.
I cannot hear the roll being taken.
Senator Kerr,
Aye.
Senator Meredith,
Explain my vote, please.
Please proceed.
Certainly be brief, but just an opportunity to thank all healthcare providers. What a great job they've done over this past year. And I think that we haven't given them enough recognition, and particularly how resourceful they have been in meeting these needs, particularly this. And, they've been stretched to the limit, but folks have stepped up, and they've done just a great job, and just can't say enough about it. So certainly I vote aye on this bill.
thank you.
Thank you, Mr. Chair.
Senator Nemes,
Aye.
Senator Wise,
Aye.
Chairman Alvarado.
Aye. Matter passes unanimously 9-0. I have to commend you. This is a good use of resources. A lot of our nursing homes struggle to find personnel that are willing to help, and if they've already got their training and they've got this is a great idea. It's using resources we've already got in place. This matter is eligible for consent. Do I have a motion? You have a motion and a second. All those in favor, please signify by saying aye. Anyone opposed? Matter is on consent. Chairwoman, thank you for being here. We appreciate it.
My pleasure. Thank you so much. Enjoy
Next
your
on the agenda we'll take up will be, we'll go with House Bill 419, an act relating to physician assistants. The sponsor is Representative Daniel Elliott. Representative Elliott, welcome. Again, no stranger to our committee. And,
Thank you,
if
Mr. Chairman, members of the committee.
you'd like to introduce yourself and your guests, and please begin your
I
testimony.
have Kevin Payton with me. I'm Daniel Elliott, State Representative for the 54th District. Mr. Chairman, House Bill 419 is, as you all are aware, after several years of careful consideration and deliberation, the Kentucky General Assembly passed Physician Assistant Prescriptive Authority in 2020. And I'm personally proud to have been a co-sponsor of that bill. after having worked with the medical community to craft a piece of legislation that improves access to care while confronting some of the very real challenges that Kentucky has around the abuse of controlled substances. While this was an important step for PAs and more importantly the patients they serve, it passed last session at the same time as our Commonwealth began to grapple with the impact of COVID-19. Since its passage, stakeholders have come together and identified tweaks that are needed to clarify the requirements around continuing medical education, or CME, hours that are required to obtain and maintain prescriptive authority privileges in Kentucky. Under the provisions of House Bill 1, passed in 2012, 7.5% of CME hours must be KBML approved continuing education relating to controlled substance, diversion, pain management, addiction disorders, and use of Casper. Under current statute, there is a requirement that PAs get 5 hours of CME to prescribe Schedule 3 through 5 substances, but that conflicts with the 7.5% requirement, as PAs are required to complete 100 hours of CME every 2 years. House Bill 419 would strike that language and instead insert 7.5 hours in place of 5 hours, and would also strike duplicative language in statute that was held from the original legislation that included Schedule 2 substances and enhanced requirements around that. That provision was removed late in the session in 2020, but the language around CME.
We have a motion and a second on the bill. Representative, again, I always tell people you said enough. That kind of works. It's convinced the committee. Any other
Absolutely.
questions or comments?
Thank you.
Senator Burke?
Thank you, sir. Quick question. This 7.5 hours is only during the first 2 years of licensure or prior to your first licensure renewal? Is there continuing ongoing requirements for continuing education and pain management and opioid addiction and withdrawal?
As a matter of fact, yes, there is. It's
Okay.
7.5% of the 100 hours
Oh, wow. Ongoing?
ongoing that PAs would be required to continue to do, which is considerably more than actually
Excellent. Thank you.
MDs and NPs and others. So it would be continuing on.
Kevin, if you could introduce yourself for the record officially. Sounds
Kevin
like-
Payton with Top Shelf Lobby, and we represent the Kentucky Academy of Physician Assistants.
Thank you. Any other questions? If not, Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Byrd.
Aye.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe.
Aye.
Senator Kerr. Senator Meredith. Senator Nemes.
Aye.
Senator Wise.
Aye.
Chairman Alvarado.
Aye. The matter passes unanimously also.
I wanted to vote aye, please.
Thank you, Senator Kerr. We'll have you down as an aye, so it passes 10-0. The matter is eligible for consent. Do I have a motion? We have a motion and a second. All those in favor, please signify by saying aye. Anyone opposed? Very good. Congratulations. The matter
Thank
is
you.
on consent. We
Thank you
appreciate
very much,
Thank
Mr.
you.
Chairman, members. Have a good weekend.
You also want to have for the record, I believe, Senator Harper Angel, you've joined us remotely as well. Is that correct? All right. Maybe she's muted or we can't hear. I got a message that she was on with us as well remotely. All right. Next on the agenda, we're going to take up House Bill 438, an act relating to Medicaid provider credentialing. The sponsor is Representative Ken Fleming. Representative Fleming, welcome. It's good to see you, and I know you have some guests. If you'd like to introduce yourself and have your guests introduce themselves, and then begin your testimony when you're ready.
Thank you, Mr. Chairman, members of the committee. I'm Ken Fleming. I represent the 48th District in Jefferson County, and I'll let my guests introduce themselves. Ladies first.
I'm Nancy Galvani, President of Kentucky Hospital Association.
Good afternoon. I'm Wes Butler. I'm a healthcare attorney out of Lexington, Kentucky.
Ladies and gentlemen, the committee, House Bill 438, as mentioned, is a congressionally bill. Basically, it helps health providers. Well, let me back up. The health providers must state, in order to get credentialing, in order to provide services in the Medicaid environment, they need to have the requirements and license and experience and education in order to provide this particular service. And then basically 6 MCOs in terms of Medicaid services. This bill basically recognizes through the DMS, the Credentialing Alliance, which is being formed in the private sector, which which is accredited by a National Committee of Quality Assurance and is owned and by and affiliated with statewide health provider and trade associations with at least 1 year. This single source credentialing process is web-based and requires certain timeframes to process application, which provides direct interaction and response to the health care provider. I can give you from my own personal experience in running a a mental health center. We have 6 providers. And so what we have to do, we have to submit application for each of our providers to 6 different firms. That's a lot of duplication, a lot of effort, and we basically spend about $5,000 in order to go through that process. So it becomes very time consuming, and it takes us away in terms of providing that services and such. So this would be really, really beneficial for us. But if you think about such places like the Healing Place or the Morton Center, the VOA, they have certain requirements. So you can imagine how much more time and effort and cost, given that they have more providers. I'll let Nancy go ahead and just give a little more background and information about the bill.
So our interest in this bill is because hospitals have a lot of providers, and many of you have heard horror stories for years about it taking many months to go through the credentialing process. As Representative Fleming said, you have to go through 6 different MCOs. They all have different processes, and that can really delay things because providers cannot be paid through the MCOs until they're through this credentialing process. And lots of times, if there's errors in the application, they didn't check a certain box, attach certain information, those applications fall through the cracks because there's no follow-up, there's nobody really working with the providers to make sure that all the information is submitted accurately so it can be processed timely. So the idea behind this legislation is to put together, as Ken said, a private sector credentialing alliance to centralize everything, a one-stop shop. Ideally, if all the MCOs join, which of course there's no mandate that they join this.
Very good. We have a motion and a second on the bill. Any other questions for our presenters? I'm going to ask one thing just very briefly. I know we passed House Bill 69 several years ago, Representative Fleming. That was your piece of legislation. Have things not been adhered to in terms of that by our experience from the Hospital Association as far as that goes? Because in the old days, when I first started with Medicaid, when I first opened up my practice, Medicaid would allow you to see patients as your credentialing went through, and they would pay you for the visits that you had prior to that. Now that's no longer allowed. You have to have it before you get paid, which makes it a big struggle to get new docs and new providers into the system. But I'm wondering, has 69 been adhered to? This is in addition to that. If you could explain that very briefly.
Senator, no, it has not been adhered to. It's been struggling and really hasn't been procured early on when it first passed, but it has been procured. There is a contract, but it's on a protest right now, and right now we're not seeing any end of the light or in the tunnel, a light at the end of the tunnel, I'm trying to say, in order to get this resolved. This is an action that this body, hopefully that will be approved to expedite that process so we can get the services out to those Medicaid clients by getting them credentialed in a much expeditious way.
Very good. We've got 2 other questions. Senator Meredith.
Not a question, Mr. Chair, just to build on your comments, because I was here when House Bill 69 was passed, and we're going on 3 years, and we still haven't got this done yet. And for a private sector solution to come forward, I think is remarkable. I commend you for that. All of you all heard me rail before about the administrative cost of healthcare, and it's just absolutely ridiculous. And here's an opportunity to cut one piece of that out of the process, and this is a good solution. I commend you for it. There is a protest on a contract, and I know from personal experience that contract will not meet the need and intent of House Bill 69. So this provides a practical solution for this, a good solution that will save the MCO's money, save Medicaid money, and also save our healthcare providers money. So just heartily encourage members of this committee to vote yes on this bill. Thank you, Mr. Chair.
Thank you. Senator Givens.
Mr. Chairman, thank you. And the passion that you've heard from Senator Meredith for streamlined credentialing is something that he's always carried and carried it very well. Thank you for bringing the legislation. A question to ask and something to consider after the meeting. If you don't feel the need to do this, then no worries. But just to make sure that we don't leave any loopholes, take a look with me at the language. At the bottom of page 2, we provide a centralized credentialing process, and we require the department to formally recognize the Credentialing Alliance. And as I read the bill, we then move on over, and once we hit the 60% trigger of each of the MCOs entering into a contract with the Credentialing Alliance, the MCOs start picking up the cost of that. Consider adding just a little language at the top of page 4 where it says, if 60% or more of the total number of Medicaid managed care organizations have entered into contracts with a Credentialing Alliance formally recognized by the department. Formally recognized by the department. The last thing we need is for these MCOs to find a Credentialing Alliance in Nevada or in wherever, enter into that, having that alliance not formally recognized by the department. If my concern carries no weight, then don't worry about it. The drafters can indicate to you if there's any loophole there. I don't know that there is, but we certainly need to close this hole if there is any hole. Thank you.
Wes, you want to comment on that?
Sure. Senator, thank you very much for that suggestion. I certainly think that's worth considering as part of the language. I think that it certainly could strengthen that aspect of it. I do think that the risk that you're pointing out is probably pretty low, but it's not zero. So if it's okay, I'll discuss with Representative Fleming and others to make sure that that would meet the intent, but I appreciate the suggestion.
And that can always be added if needed as an amendment, if you consider that to be necessary. Senator Berg.
Thank you, sir. I think I have one question. It says the department shall formally recognize a credentialing alliance. I'm assuming that hasn't been formed yet, correct?
It's in the process of
It's
being
in the
formed.
process. Okay, and they will do primary verifications?
It will be a full credentialing service, not just primary source verification, but also the committee review, which is actually reviewing the information, and active provider outreach to work with, as I said, applications that have errors, to make sure that, a provider doesn't miss an email saying, there's something erroneous in
Okay.
your application. So it's a very comprehensive service.
Some hand-holding,
Yes,
basically,
absolutely.
for your providers.
Yes.
I think my single real question then, assuming all of that is in place, as a diagnostic radiologist, I'm licensed in multiple states, and I have been through this process. Basically, with primary verification on a national level, it's extremely expensive, much more expensive than if I had chosen to try to go through the process individually in each state on my own accord, which would obviously be a big pain in the butt, but would be more cost effective. Do we have an idea of what this is going to cost per provider?
The cost can be lowered, obviously, if more MCOs join the alliance.
Yeah.
So I think,
Baseline estimate of what the cost for your initial provider to get primarily verified and credentialed through this?
well, to do it, if you're just doing it for one MCO, it's probably going to be over $100. But again, if you divide that by 6, it could be as low as maybe $30
$100 per provider.
to do, yes.
Well, that's
For
very
one, for one.
inexpensive. That
For
would be
one, yes.
extremely inexpensive. I'm talking about, I'm used to paying about $3,000.
Oh, wow.
So this is going to be a cost-effective solution, is what my question is.
Yes, definitely.
Yeah, and
Okay,
Senator Berg.
thank you.
Thank you. Any other questions? Yes, Senator Howell.
Representative Fleming, thank you for bringing this. I'd like to see anything that streamlines legislation in, and I appreciate you letting me cut you off. I was a classmate of the gentleman sitting to your left and was always about a step and a half behind him in every class we had, and I've waited 25 years to get the last word in, and I wasn't
There
going to
you
pass
go.
up the opportunity. Good to see you, Wes.
Good to see you, Senator.
Very good. I think that's another vote that you'll probably get there. Any other questions from anyone else? If not, we have a motion and a second. Madam Secretary, please call the roll.
Senator Rocky Adams, Senator Berg,
Aye.
Senator Carroll,
Aye.
Senator Givens, Senator Harper Angel, Senator Howe,
Aye.
Senator Kerr,
Aye.
Senator Meredith, Senator Nemes,
Aye.
Senator Wise,
Aye.
Chairman Alvarado.
Aye. The matter passes 10-0 unanimously. This is eligible for consent. Do we have a motion? We have a motion and a second. All those in favor, please signify by saying aye.
Aye.
Anyone opposed? Very good. Congratulations. The matter's on consent. If you'd like to consider that language, if you think that would be something that would help, if there's a potential loophole to close it, we could always add amendment on the floor for that as well.
Okay. And Mr. Chairman, I'll have Mr. Butler get with Senator Gibbons, and they can work it out, as well as myself. We can go from there.
Just let us know. We appreciate that. Thank you so much.
Thank you.
Very good. All right. Now we have a couple of freshman legislators. And so the next item we'll take up will be House Bill 448, an act relating to child welfare. The sponsor is Representative Bill Wesley, but from what I understand, Representative Wesley is in his district today working with a lot of folks regarding all the flooding. I know they've been very heavy hit in his district. So in his stead is my state representative, Ryan Dotson. So Representative Dotson, welcome. If you want to introduce yourself for the record and your guests, and begin your testimony when you're ready.
Thank you, Mr. Chair and committee. Again, I am standing in proxy for Representative Bill Wesley, who was called away back to his district by Congressman Andy Barr to assess the damage after the flood. But we're here today with Michelle Sanborn, Children's Alliance. We have with us on Zoom Judge Brent Hall of Hardin Circuit Family Court, and C.J. Quick, who is co-owner of Brighter Futures Counseling. So today I'll be speaking on House Bill 448. This measure would expand the list of those classified as a qualified mental health professional for the purpose of child welfare. This bill would also allow private agencies or companies to qualify, therefore expanding access to care and allowing more mental health professionals to participate in welfare hearings. This small change will update the current definition of a qualified mental health professional to mirror the definition found in our state's juvenile code. This is necessary because there are times when therapists and counselors are asked to give testimony in court.
I'm Michelle Sanborn, I'm president of the Children's Alliance, and I would just like to give my time to Judge Brent Hall since he's on with us and he can speak briefly about this.
Absolutely.
Senator Alvarado, members of the committee, a qualified mental health professional is defined two places in the Kentucky Revised Statute. One is under KRS 600-020 and one is under KRS 202A-011. The KRS 600-020 is a statute that also defines what an abused or neglected child is. As part of that statute, an abused or neglected child is one that has suffered an emotional injury under KRS 600-020 1A, 1 and 2. An emotional injury has to be testified to by someone who qualifies as a qualified mental health professional. What we have is people in private practice that because of where they work, they don't work at a community mental health agency or regional hospital, but because they're in private practice, they otherwise do not qualify to give that testimony under 600-020, but would qualify under KRS 202A-011. And so largely the Cabinet for Health and Family Services does not pursue cases involving an emotional injury because, quite frankly, we cannot get the testimony that we need from our practitioners to prove the existence of that. We treat a lot of emotional injury after a child has been physically abused, but we don't remove because of an emotional injury. And this would make the two definitions more consistent and allow people that were similarly educated and had similar backgrounds to be able to testify in court to give us the information that we need.
Very good. Thank you. And I know we've got, I don't know if anyone else is wanting to testify. CJ Quick was on, or if they're available online.
She's on.
Is she? Okay.
Yes.
If there's anything you want to add?
I think Judge Hall said it perfectly. I think it boils down to the fact that as a counselor, as a marriage and family therapist, I can see a child who can tell me what they're going through at home, the kind of emotional turmoil they're going through, being threatened, verbally torn down. But I can't speak for them simply because I'm in private practice. So the exact same experience, less experience, credential license, if I'm working in a different location, I'm qualified, but simply because I'm in private practice, I can't. So that's all I can add to it.
Very good. Very good. Thank you. We have a motion. Is there a second? You have a second. Just one quick thing I want to make sure we clarify for the record also. We just passed a bill, Senate Bill 21, which dealt with a lot of homeless youth, and it kind of also defined qualified mental health professionals. This, from my understanding, is it ties into that bill that we passed earlier this session as well, correct?
Yes, so this issue was brought to my attention when we were working on Senate Bill 21 previous years, where we were actually referencing an adult statute in regards to a children's issue. And so I said, well, why aren't we referencing 600? Because it's defined in 600. And they said, well, those have two different definitions. And that's confusing in and of itself. So looking at the impact of why, but also aligning those definitions makes sense.
Very good. Thank you. So I want to make sure that's clear. We have a motion and a second. Any other questions or discussion? If not, Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Byrd.
Aye.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howell. Senator Kerr.
Aye.
Senator Meredith. Senator Nemes.
Aye.
Senator Wise.
Aye.
Chairman Alvarado.
Aye. The matter passes unanimously 9-0. This is eligible for consent. Do you have a motion? Do you have a motion, a second? We have a second from Senator Berg. Very good. All those in favor, please signify by saying aye. Anyone opposed? Matter is on consent. Thank you very much.
Thank you. I hope the other
Congratulations.
bills I bring to this committee passes easily. Thank
We
you
wel-
so
we wel-
much.
We welcome your presentations, Representative Dotson. Thank you. Senator Berg, yes, please.
Yes, sir. Thank you. Is it possible for me to record two votes from, I would like to record aye votes on House Bill 48 and House Bill 202?
Thank you.
And
It'll
I
be duly
believe I
noted.
was here for the rest of them.
We haven't done.
We haven't done 202 yet. We're about to do that.
Oh,
but we'll
never
put you
mind.
down for 48.
Okay, thank you.
We try to go in order from seniority down to our rookies. So we have, and they're not least by any means, but it's usually what we try to do. We have our House Bill 202 enact relating to nursing. The sponsor is Representative Jonathan Dixon. Representative Dixon, if you want to come forward, welcome to the committee. And if you want to introduce yourself and any guests that you might have, I know we've got, Mr. Morgan Ransdell and Ms. Jessica Estes from the Board of Nursing also remotely, and we might have some questions on this bill, but if you'd like to introduce yourself and have them introduce themselves and begin your testimony.
Absolutely. Thank you, Chairman Alvarado. Committee members, thank you for having me today. House Bill 202 is a simple Kentucky Board of Nursing housekeeping bill. It doesn't make any major changes. It's all minor changes and clerical changes to the current law. And as far as that goes, I'll keep it short and sweet with that. If anybody has any questions, I'll be happy to entertain those.
Thank you very much. Mr. Ransdell, any comments? Are you available just for questions?
Yes. Hello, everyone. I'm Morgan Ransdell. I'm General Counsel for the Kentucky Board of Nursing, and I'm happy to answer any questions you have regarding our bill.
Thank you very much. All right, Senator Givens.
Mr. Chairman, thank you. And I welcome to Representative Dixon. Welcome to Health and Welfare.
Thank you.
Appreciate the work you're doing. I have some questions. To clarify, and I certainly feel like this is totally housekeeping, and it may be the Board of Nursing folks that need to answer the questions. As we open with new language and the practices of licensed certified professional midwives, I think that's clarifying language. Are we simply restating what we see under Section 1, Sub 2, Sub A, where we see the word certified nurse midwife? Is that the same title as licensed certified professional midwives?
Thank you. I will defer that question to Mr. Ransdell.
No, those are two different types of licensure. Nurse midwives are separate and regulated separately from licensed certified professional midwives. Sometimes the licensed certified professional midwives are referred to as direct entry midwives, but they do not hold the nurse title. They were recently created as a new license type in 2019, and we've just begun issuing licenses to PMs, licensed certified professional midwives, in 2020.
And everyone in that arena acknowledges your licensing board as the board for which licensing should occur. Great.
Yes, they do.
Thank you.
We have approximately 25 LCPMs currently licensed in the Commonwealth.
Great, thank you. And then when we move to page 5 of the legislation as we have it in front of us, We have a lot of language that's struck through as it relates to advanced practice registered nurses. As I read the language, I think this is solely cleanup based on C, sub C on page 5, providing the same mechanism, and apparently it's duplicated in 2 places. Is that what I'm seeing?
Yes, Senator. There was actually redundant provisions in the statute. There was a need for those redundancies at the time the statute was enacted, but now we were simply modifying and removing the redundant language. It'll have no impact upon the application of the statute to our licensees.
Let the record reflect, Mr. Chairman, that we enjoy redundancies when they are needed, and we don't enjoy redundancies when they're not.
Red tape reduction, as they say. Any other questions or comments? You have a motion on the bill. Is there a second? You have a second from Senator Berg. If there's no other questions or comments, Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Berg.
Aye.
Senator Carroll. Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr.
Aye.
Senator Meredith. Senator Nemes.
Aye.
Senator Wise.
Aye.
Chairman Alvarado.
Aye. The matter passes 9-0 unanimously. This is eligible for consent. Do we have a motion? You have a motion. Is there a second? You have a second. All those in favor, please signify by saying aye. Aye. Anyone opposed? Very good. The matter is on consent. Representative Dixon, congratulations.
Thank you, Chairman Alvarado. Ladies and gentlemen.
Thank you very much. And very successful. We have a few members who might want to register a few more votes. Senator Berg.
Yes, sir. Thank you very much. I'd like to register I votes, if I haven't already done so, on House Bill 427 and House Bill 276.
Very good. That is duly noted. Any other votes need to be cast? Any other issues before this committee? I would encourage all members to watch your emails this week. We likely will have one more meeting probably next week at our normally scheduled time of 10 in the morning. So please watch your emails this week, and hopefully you can all oh yeah, we also have a scheduled joint meeting with the House and Senate on March the 12th, Friday, just to take up a block grant. So we'll be here upon adjournment for that as well. So just make sure that's on your schedules. Thank you all for being here and your flexibility. Enjoy your weekends. We stand adjourned.
Okay, now I can pee.
Okay, now, Mike.
Mikey, it's over.
It's all no. I have to. We got to figure out Jerry Miller's bill to rein in our asshole, the mayor.
Careful now. I know an asshole.
He's the worst. Okay, do you have a minute to talk?
Sure. I've been waiting.
Okay, so I've been getting these heads up. Impotence.
No, don't worry. I knew where you were.
Yeah, yeah. I need to check the box so that I can say, I asked him, I really think that you have a job. Okay. Right. Okay. Then I think that is the period.
Democrats going to stay Democrat, but here's what they say.
See, that's where I am. They already have it.
So we're not.
Leave it alone. We're not creating another thing. Correct. Correct.
Because they could already.
No, I'm just gonna say, we had a conversation, FOP. The only way we're gonna get it out of our chamber is if the FOP likes it. That's the reality. That's, but anyways, that's my talking point, is that if we have the conversation, the only way we're gonna get it out of our chamber.
Mike's with it. Mike's been talking about four nephews and police officers.
Right.
And Mike's the one that talked me.
Yes.
And I'll take that.
Okay, that's our checkbox.
You said it to me because I.
Yeah, and I told him, I said, listen, Mike's the one who's gonna this. Yes, I talked to Jerry this morning.